Hello and welcome to the treatment portion of our clinical psychology unit. Today we're going to be talking about the different types of psychotherapy or talk therapy that is available in the field of psychology. We're going to be looking at treatment from the lens of the psychological perspectives. So if you remember from the beginning of the psychology lessons, the 7 psychological perspectives are the different ways that psychologists explain behavior and mental processes. It's also the same process that psychologists use to go about determining therapy based on their particular field. So let's go ahead and get started. The first perspective we're going to take a look at is the psychoanalytic and psychodynamic perspective. This is based on Freud's perspective of what makes us who we are and how a psychoanalytic psychologist would go about therapy. So if you remember the psychoanalytic perspective, the major focus is on early childhood experiences and unconscious motivations. And so that would be the source of the psychological disorders that we would see in an individual. So how we would go about treating those individuals would be through the different techniques of psychoanalysis. So free association, dream analysis, maybe hypnosis, ways to get into the unconscious and try and understand what's going on beneath the surface. Psychologists would try and understand what people are resistant to in therapy and if there is any evidence of transference, where a person is transferring their feelings from another person onto their therapist. Contemporary psychodynamic psychology would focus more on current emotions and current relationships, using the therapist-patient relationship as a model for all of our other relationships, focusing on healthy communication and interaction. Humanism psychology, as we remember, focuses on self-determination, free will, and growth. And so a humanist psychologist would focus on self-acceptance and help facilitate growth in their client. Humanist psychologists use what's known as client-centered therapy, where the focus of the therapy session would be allowing the client to develop their own answers to the questions that they have about what they should do in order to better help themselves. The way that they would do this is through what's known as active listening. The role of a humanist therapist is not to tell the client what to do. Instead, they are essentially a sounding board. They are there to listen and help clarify the thoughts that an individual has without actually giving them advice on what they should do next. The idea is to help a person come to their own conclusions about what they should do and let them know they have the free will to actually go ahead and do that. The behaviorist perspective, or in modern day, we see it as cognitive behaviorist therapy, focuses on those current thoughts and behaviors and how to go about changing them. This is where we would see a lot of therapy for things like anxiety, phobias, and obsessive compulsive disorder really put into play. They're going to build on the techniques of the behaviorist approach, using rewards and punishments to shape behavior by using techniques such as counter-conditioning, systematic desensitization, which, as we mentioned before, is that technique of working up a hierarchy of, say, phobias or anxiety-producing events and working on progressive relaxation at each one until a client can face whatever is the greatest anxiety-producing event for themselves. Exposure therapy or flooding is very similar, but instead of working up to that anxiety-producing event, flooding consists of exposing a client to that fear right away and allowing their anxiety levels to reduce themselves naturally. Other techniques we can see used in the behaviorist perspective include aversive conditioning to help remove bad behaviors. The bell and pad technique is something that is used to help treat things like bedwetting, and token economies, which are used to start with smaller behaviors and work up to a larger reward for meeting a goal. And finally, the cognitive perspective is going to focus on thoughts. How can we change the way a person thinks? Cognitive psychologists believe that the source of a person's discomfort or unhappiness comes from irrational or illogical thinking, and that is going to manifest in extreme emotional responses. If our thought process is illogical, our emotions will be extreme. However, if our thought process is logical, our emotions will be moderated. So the cognitive perspective might use something like rational emotive therapy to try and challenge and change the cognitive processes a person has. Psychologists such as Beck and Ellis would use rational emotive therapy and look at those automatic negative thoughts a person has and go through a thought challenging technique to try and change those irrational thoughts and reprogram them to be more rational and more logical. So the process behind this cognitive rational emotive therapy would be to look at every single negative thought a person has, these automatic thoughts that we might have about ourselves and our world, and work to rewire them into more rational alternatives until this becomes an automatic process. It's a long process, but it does have a lot of success when looking at rational emotive therapy. So these are the different psychotherapies or talk therapies that we can see used in modern psychology today. Oftentimes we'll see psychologists use a variety of techniques because the idea is not to treat the psychological disorder, but what we're doing is treating people. And each person is going to come in with their own symptoms, their own history, and the treatment options should be tailored to that individual. So psychologists might use a variety of techniques, so a biopsychosocial approach or eclectic approach to treatment that best suits the individual and what they are currently experiencing. In our final video on therapy, we're going to look at the biomedical perspective, so different medications and other biomedical interventions and therapies that can also be used to treat psychological disorders. Thank you so much for watching, and remember, be kind to your mind.